The authors have no financial interest in this presentation. Anxiety has been called a silent killer because it acts as a double-edged sword. On the one hand, it can heighten responsiveness to a certain situation, but on the other hand, it can be very disabling. Anxiety is defined as the emotional state in which a person experiences uneasiness, apprehension, or fearfulness. People usually experience anxiety about events that they cannot control or predict. Therefore, there can be an associated feeling of vulnerability. Anxiety that is severe can be disabling due to increased heart rate, inability to concentrate, excessive sweating, dry mouth, and even shivering. Everything is normal if it is experienced in moderation, but any excess of these feelings can be harmful. In our hospital, approximately 45,000 patients underwent cataract surgery in the year 2017, of which 1.6% had complications and 0.4% of them were strictly attributed to uncooperativeness due to anxiety. Despite ample time being spent in counseling the patients for cataract surgery, having surgery can be a stressful event to a patient because he or she is unaware about the final outcome. Possibilities of having less than perfect vision, the financial cost of surgery, and the possibility of complications apart from other domestic worries may trigger a feeling of worry or despair. A patient's anxiety starts from the time they are informed about the need for surgery. This feeling triggers the sympathetic activity leading to undesirable effects such as tachycardia, hypertension, and possibly even ischemic attack. The additive effect of fear, anxiety, and despair may cause some patients to become uncooperative during the surgery, thereby leading to unnecessary and avoidable complications. This emotional state, which leads to needless complications, is, however, not addressed as appreciably as much as getting the consent signed and informing the patients about possible complications. How do we address this and prime patients psychologically for surgery? In our literature review, we found that periocular anesthesia, intravenous midazolam, mediclowns, and music therapy have been successful in reducing the anxiety levels of patients. Additional preoperative counseling by bringing the surgical procedure to the patient's knowledge and alleviating specific apprehensions goes a long way in making cataract surgery safer. We have also designed a new light source similar to that seen under the operating room microscope for counseling regarding the visual experience during cataract surgery. Periocular anesthesia reduces pain, making patients more comfortable. It also causes akinesia and makes the surgery less dependent on patients' cooperation. This is compared to topical anesthesia, in which the patient needs to fixate on the microscope light and look straight ahead for optimal performance. The other option is the use of intravenous midazolam, which sedates the patient, thereby reducing their anxiety. We performed a prospective randomized triple-masked study to see the effect of intravenous midazolam on patients' experiences during phaco emulsification under topical anesthesia. Patients were randomized to two groups, one with intravenous midazolam and another with intravenous normal saline, following which they underwent the surgery with intraoperative vital signs being monitored. Vital signs were checked 15 minutes after the procedure, and questionnaires were also given to the patient 6 hours after completion of the surgery. We found that fluctuations in perioperative vital signs were significantly lower in the midazolam group in terms of systolic blood pressure, heart rate, and respiratory rate. Surgeon score for patient cooperation during surgery was also slightly better in the midazolam group. Fear was significantly lower in the midazolam group compared to the control group. And finally, pain was lower in the midazolam group. Various studies have also described the beneficial effects of music therapy on patients who are about to undergo ophthalmic surgery. Cruz and others have suggested that elderly patients undergoing cataract surgery under retrobulbar block were more satisfied with their experience if they heard relaxing music. Bellin and others suggested that for patients undergoing cataract surgery, efforts should be directed toward reducing anxiety on arrival at the institution when it is highest and not just during surgery. Also, oral sedation and listening to music before surgery appears to be beneficial. We performed an additional pilot study assessing the effects of listening pre- and perioperatively to music of the patient's choice to assess his or her experience during cataract surgery. We found that music therapy decreases physical and mental measures of stress during cataract surgery, and these findings correlate with existing literature. The common theory regarding the mechanism of music therapy in alleviating anxiety is that it acts to distract the patient's attention away from negative stimuli and towards something more pleasant and encouraging. Music can bring a patient's mind towards something familiar and soothing. This allows a momentary escape from the current situation. Novel methods aimed at reducing anxiety include the use of mediclowns. Mediclowns are people dressed as clowns who provide some distraction to patients having a traumatic experience. We invited mediclowns to our hospital for the purpose of reducing the anxiety level of the patients before surgery. The mediclowns utilize numerous techniques and tools that reduce stress and anxiety while bringing joy and laughter to patients. The difference between a regular clown and a mediclown is that mediclowns can go beyond provoking just laughter and entertainment. They also address the specific healthcare needs of our patients. Thus, we hope that by appropriately employing these suggestions we have mentioned, we will be able to reduce patients' anxiety and reduce a proportion of needless complications from cataract surgery.